Hello, everyone, and welcome to the What's Your Everest podcast. My name is Liam Hubbard. I'm an intern here at Everest Strong Coaching, and today I am co hosting the show with Dr. Carla Steingraber, the head of Everest Strong Coaching, and a certified mental game coach who is a licensed clinical and sports psychologist who's been practicing for nearly 20 years now, working with athletes of all age levels, skill sets, sports, just helping them improve their mental game. And today, our guest is Dr. Michael Byrne. We are thrilled to welcome Dr. Byrne to the show. He is a Chicago based MD adult psychiatrist and has his private practice, Byrne Psychiatry, where he treats a wide range of conditions and has various areas of focus, including sport and performance psychiatry. And in addition to his private practice, Dr. Byrne is also a teacher of psychiatry and the medical director of the Transcranial Magnetic Stimulation Clinic at Rush University. And Dr. Byrne, we are so grateful to have you on the show today, get to learn some more about your expertise. Welcome to the podcast.
Yeah, thanks for having me.
And you go by your middle name, Jake Byrne, as
Yeah,
opposed to your
it's
first
super
name.
confusing. Yeah. Yeah, I go by Jake.
Apologies
Not
for that.
MJ.
I do NJ just so people won't call me Michael.
Not to be confused with the MJ, Michael
Yeah.
Jordan. Fair enough. Well, tell us a little bit about what inspired you to pursue psychiatry in the first place.
So why psychiatry in the first place? So in med school you're doing, rotations and all the specialties, and you're kind of hoping something will click and that you'll kind of find your people. And I think, yeah, it wasn't until psychiatry, which before that was never on my radar, that that I was actually pretty interested in the rotation, kind of showing up a little bit early, staying late, and even after my psych rotation, I would end up doing presentations on like psych projects, or psych topics. So it became pretty clear at that point that that's what I wanted to do. And and yeah, definitely no regrets at this point.
Yeah. How about how you got involved specifically in sports psychiatry? Because this is not a subset that most people have really heard of, or that I hear people talking about. It's very specialized and new.
Yes, yeah, it is pretty subspecialized, and it was not on my radar until the past year or two. Um, I How I got interested is because I just started in my own clinic, started having treating some patients who are athletes, and I really enjoyed that patient population. I found I liked sort of the very goal oriented kind of outlook about these patients. I liked I, that's how I like to treat. I like to kind of have like very specific goals about this is what we're doing, this is what we're targeting, um, and um, and so then there is a now an American Board of Sports and Performance Psychiatry. So that's why I got involved in that, just to kind of formalize sort of my setup within treating athletes and other performers.
Yeah, it's definitely really different working with athletes and how goal oriented they are. What do you find with your other clients in terms of pursuing medication choices?
With perhaps non-athlete clients.
Yeah. Hmm.
Yeah, so I think like a typical patient, um, as opposed to like a specific athlete, is that they tend to be much more open to medications, side effects. They can kind of roll with them a little bit more than an athlete can, and and sometimes you know it's more of a partnership and kind of developing goals where I kind of have to like kind of tease out like what exactly are we looking for, like kind of what's our target. Whereas an athlete, a lot of times, like they'll come with a very specific thing. Like this is what's getting in the way. So there are kind of some easy measurables there. So um, yeah, but outside of that, it's you have more leeway, with treatment options. Like I said, like they're just you know they're not as sensitive to side effects
Mhm.
with medications.
Right. And looking kind of overall at your practice with burn psychiatry, what makes your approach unique?
So I guess what I like to think about my practice as being as far as kind of unique is that medications aren't the be all end all for me. I got really interested in lifestyle psychiatry as well, and it was actually the sort of the focus of our big American Psychiatric Association meeting this past May. So whenever I'm seeing somebody and we're discussing the plan going forward, I like to kind of frame everything in like three buckets of interventions. One of which is medications. The other is psychotherapy or talk therapy, and that might take the form of like one-on-one therapy, group therapies, maybe just brief therapeutic interventions with me. And then the third bucket is lifestyle interventions, and that can include anything from physical activity, diet, socialization, or kind of connections with others, stress management, which within that you kind of have like the mindfulness type stuff, um, reducing toxic exposures, so that kind of stuff. And I put all of those things on equal footing. Like I think the lifestyle stuff is just as important the as the medications, just as important as the psychotherapy. So that's kind of that's kind of my outlook, and I really try to stress that with my patients. And we can those are all the levers that we can push on. So if you don't want to push on the medications as much, that's fine. And it depends kind of what we're treating exactly, but we should probably push the other two levers more so. So I think I'm just kind of more open to treating things a little bit more holistically and kind of using all the available tools.
I'd
Yeah, that
be
makes
curious
sense.
there. Oh, sorry to interrupt, but I'd be curious there. Like with an athlete, very often their nutrition is already quite optimized. Obviously, they're exercising
Yeah.
plenty. Um, I'm assuming they've also optimized sleep. So, what other lifestyle factors? I'm guessing stress and things like that, but what other lifestyle factors can you work with them on?
So usually, yeah. So diet and exercise, I there's not much to mess with there in these patients. That said, like we do have like a higher proportion of eating disorders in athletes. But yeah, so as far as kind of the things that you will notice is like the connection part. Just like staying very social and connected with people, particularly if you're kind of like like a not a team sport, that it's more important there. Stress management, very important, because these are very driven, patients with like high perfectionist tendencies. So kind of let's figure out what's sustainable with that, and kind of like um uh being able to first like identify signs that like you are kind of stressed and to a pathological level, and then kind of so that maybe we need to kind of intervene and with some mindfulness and kind of some relaxation or kind of self-care, call whatever you want. um so so yeah, really the stress management, socialization, uh and those tend to be kind of maybe more of the more pertinent lifestyle interventions with athletes.
You mentioned eating disorders. Are you seeing them as more prevalent across the board with athletes, or is it more specific to, say, gymnastics or ballet?
Yeah, so it's generally more common in certain sports, specifically sports that are like aesthetically, there's an aesthetic component to it, like gymnastics, ballet, like you mentioned. Um, sports also in which there is sort of like subjective judging for it, like perhaps like a synchronized swimming, I gymnastics again. So those are kind of two big risk factors for development of eating disorders in athletes.
Mhm. So for our listeners who don't know, that one big differentiator between psychiatry and psychology is the psychiatrist obviously had to go to med school, and often the medical, the health, physical health is the primary focus, and obviously with psychiatry rotations, medication management, et cetera, for psychological issues. And with psychology, right from the beginning, you're focusing on the mental health components. But what about the nuanced difference between a psychiatrist and a sports psychiatrist?
So, within that, what I would say is that there's a lot of subspecialties within psychiatry because it really can be a pretty broad specialty. So the benefit of kind of getting subspecialized within a certain population, whether it's like geriatrics or it's pediatrics or addiction or sports and performers, is that you kind of whenever you're meeting with the patient, you kind of have to learn them. You have to learn kind of like all about like their priorities, like their culture, like what everything's all the moving pieces. So if you already kind of have a leg up and sort of like you're already treating a bunch of athletes, then you kind of have a better understanding of the culture, kind of like where they're coming from, what they're talking about, what their values are, all of that stuff. So, and that's kind of just treating any population. And then other things specifically with athletes is that you you're going to see kind of you're going to be more familiar with the typical pathologies that are going to come up in athletes, and then also kind of you know the you're going to be more familiar with the typical kind of treatments, interventions that with athletes. Like I kind of alluded to earlier, like athletes tend to, be a little bit more sensitive to medications, generally kind of a little bit more reluctant to medications. Like, they're working so hard to kind of, you know, um, get into like a very, top physical form. They don't want anything potentially interfering with it. So if we do use medications, we're using lower doses. Obviously, like if you have to balance considerations for like for WADA, the anti-doping agency, and stuff like that, if that's relevant. Um, and then so yeah, it's just kind of a lot of tailoring to those approaches, and then also just kind of knowing how to talk with with these patients. Like um, again, I kind of go back to like my athletes are like they're just very kind of perfectionist, goal oriented. So
Mhm.
if you can kind of match that energy, or you can kind of match their goals, then it kind of works out better.
I wonder if there's a degree also of trial and error. A reason I ask is I was reading this book called Running is My Therapy, and the author was talking about how one particular competitive runner took some kind of SSRI and found it significantly improved his performance, and another one took it and it slowed him down. And I don't know if that's because of how depression can manifest itself differently in people, or how severe the depression was, or sometimes people respond by sleeping better with SSRIs, whereas others, they're awake all night. So I don't know if you have any
Y-
thoughts on that.
Yeah, I mean, everybody reacts to these medications differently, and athletes, non-athletes. So anytime that like somebody's coming to me with like a side effect that like doesn't sound, it doesn't quite sound right to me, I'm still just I take it at face value. I'm like, everybody reacts to these medications differently. That's fine. We'll back off. We'll go in a different direction. Whatever it is. Um, so yeah, it's just yeah, you just really have to kind of tailor exactly the right approach to every patient. There's really no one size fits all. I mean, it sounds like such a cliche, but it is true. Athletes, non-athletes.
And what are some of the most common mental health challenges that you're facing with the athletes you see in your practice?
So still similar kind of to, anybody that I treat in the sense that depression, anxiety, ADHD, those are the big things, outside of that, it's kind of more rare to have more kind of, um, bipolar spectrum illnesses or primary psychotic illnesses, although the, you know, that does occur. And I do have those situations as well, but depression, anxiety, ADHD, probably the better bread and butter.
And then another thing is stigma. Stigma and mental health are sort of have been intertwined for a lot
Mhm.
of history, and things are gradually changing as talking about mental health and treating mental health has become more accepted. So I'm really curious, how have you seen this stigma changing specifically with mental health in sports, but also what still needs to shift?
So I think it's I mean, and I haven't been treating athletes for that long, but like my sense is that it is changing a lot. And I think that's probably the culture at large. But so the American Board of Sports Informant Psychiatry, they're even like to that, they're partnering with like the NFL coming up in November. And so there's like these like three mental health games that they're kind of like um I don't know if it's a sort of a partnership with the NFL and the ABSPP, where I think there's just going to be much more knowledge about it at that level. Um, I think obviously like in high schools and colleges, like there's discussions about this. So it's definitely it's out there a lot more so than like when I was in high school. I would imagine.
Right.
And even like so outside of athletes I also treat musicians and such, and there's definitely more of a conversation there. I'm associated with the organization called Backline, and they work to really connect anybody within the like musician world, not just musicians but people maybe who are like going on tour with therapists, psychiatrists, whatever they need. And a lot of what they do is like they're just doing awareness for it. Like they're putting up posters in the green rooms. They're having like big celebrities like your Chapel Rowans kind of talk for them and stuff like that. So I think there's efforts in like a lot of spheres to kind of just normalize it and kind of saying like if you need it, like here's where we can go.
Right.
And then as far as kind of like areas, obviously I don't think it's perfect. I think it probably still exists out there to different degrees and um, uh, different sports and spheres of life and stuff. Um, I can't say like here who exactly is kind of the squeaky wheel, but other than to say like I think it's just kind of generally kind of seeping in and becoming more normal, and everybody's kind of um, a li- gradually getting more comfortable with getting help when needed.
Walk us through a little bit how you would address an athlete, work with an athlete dealing with performance anxiety or burnout, where it's started impacting their performance.
Yeah. So a lot of it is I want to do kind of a full assessment of like what is your life like, what's it like right now, and kind of like how did you get involved in the sport, since like since what age, and then kind of following it through being like, so maybe when you were playing tennis as a kid, like do you remember enjoying it up until a certain point,
Mhm.
and what did it maybe represent at that point? Do you have a sense of kind of when that changed? um, and then yeah, just kind of I would want to kind of really understand, just basically learn the patient, and then kind of go back to their goals. Like, are you um, is this something where in which you want to kind of reconnect with, and you still kind of want to compete and everything like that. maybe it's a matter of kind of uh, fleshing out, current life and making sure, kind of going back to what I was talking about, like making sure that there's good stress management and connection with others, and that like, um, and then also specifically with athletes, there's a lot of sort of they put a lot of their uh, self-worth
Mm.
and their identity is attached to their sport. So kind of allowing that and kind of probing the patient to kind of expand beyond that's the sport as sort of their identity as well, can kind of give them a little bit of breathing room,
It's
um,
hard for them
as well.
often, right? Because they don't have a
Yeah.
lot of free time to explore other aspects of themselves.
Yeah. So and you don't start big. You just kind of start small, being like, are there other things you enjoy? Are there other things that you've thought about doing? And then, maybe it's just kind of small goals. And sometimes it's a matter of like going through your day. Like, what does this look like? Is there an hour here you can squeeze in, doing this other activity potentially? You know, so yeah, that can be really tough. It just depends. But yeah, sometimes what they're in is very demanding.
Yeah.
That makes sense. And then in terms of working with athletes versus the non-athlete clients, there's the array of different specific tools, techniques, medications, therapies that you've discussed. I'm really curious when it comes specifically to athletes for improving mental resilience, are there specific tools that work more effectively than others?
Specific, um, specific like interventions that might work better as far as kind of
Yes.
resilience. Okay,
Yeah.
yeah. So I don't know. I honestly don't know if there's anything that I would say more so with an athlete than a non-athlete. Usually it is uh, a matter of, again, I go back to like the lifestyle stuff. I kind of find where are the weak links there, and then I try to like really counsel on that and kind of help the patient kind of prop up those weak links and different lifestyles. Um, and then sometimes it's a matter of, perhaps more so with athletes, looking at the perfectionism a little bit.
Mm. Yeah.
Um, so like perfectionism is very adaptive and very helpful in some situations, and very maladaptive and detrimental. So, kind of learning, and it's a lifelong process, but learning kind of when it's helpful, when it's not, and being able to kind of modulate that appropriately.
Right.
Well, in fact, I mean, I often say to my clients, don't let perfect be the enemy of good,
Yeah,
because it does often get in the way of performing, or even the mental freedom to learn from mistakes. And that's one big differentiator I see between non-athletes and athletes, is the athletes have in their mind that there is a specific number of hours, shots, swings, whatever,
hmm
that they have to do each and every day, and they have to do it a certain number of days in a row. It might not be exactly obsessive compulsive, but there is a certain obsessive component around meeting those routine requirements and the training, etc. Whereas with and just to finish that, I want them to soften a little bit and start putting the emphasis more on the process as opposed to the outcome. Whereas with my non-athletes, I find we have to work on even starting to understand how goal setting might be really
yeah,
useful and beneficial, and if there's a certain resistance to following through with certain goals, really uncovering that resistance. So it's a different angle.
yeah, absolutely. I think that I would agree with that. Where it's like with athletes, you kind of have to put the brakes on the goals a little bit at times,
Yeah.
or that allow them to kind of zoom out and be like, okay, well, is this actually a helpful strategy? Whereas with non-athletes, you're almost kind of trying to put on the gas a little bit, like, hey, let's talk about how beneficial kind of goal setting can be.
Yeah. Yeah. Any advice that you would give to parents or coaches or trainers who want to support the mental well-being of young athletes?
I mean, the big thing, and I don't treat really adolescents, but the big thing within our literature is as much as possible, kind of, especially for young athletes, for kids, um, allowing it to understanding that at that level of what they're doing is not to be good. What they should be getting out of it is sort of like understanding like team dynamics
Yeah.
and struggling with something and getting better with it, and enjoying it and stuff like that. It's not to um, become like the youth champion of something, just kind of really understanding like at that age, like that's not what you should be doing. And then maybe as like they get older, they become kind of an older teenager, they're maybe perhaps getting a little bit more specialized, but really just kind of keeping it in context of like you know where they're at in their level. They might not be an elite athlete yet, so you kind of have to um, let it sort of mature, and then also just really letting kids play multiple sports, especially as like a young kid, you know specializing too early in sports, has been shown that a lot of the literature to be kind of negative down the road.
Yeah, even beyond the overuse injuries, just getting sort of stuck in one idea,
Hmm.
one path towards the future, and not having that flexibility and seeing the development across the board. Yeah,
Yeah, yeah.
yeah. How do you navigate the balance between ethical care and competitive fairness? Because there are some sports where stimulants get used, for example, beyond for treating ADHD, but certainly for speed or stamina.
Yeah, I mean, so fortunately, I haven't been in a situation where I was uncomfortable or I felt, like this wasn't being used appropriately. Um, but honestly, with that, I would go back to what is best for the patient here, outside of like their needs or their kind of subjective needs for kind of what they need for their sport, and also, and this I tell residents to this all the time, but if you're ever feeling like you're treating somebody and you're being sort of boxed into a corner, or it's sort of like you don't like the patient wants you to prescribe something and you feel kind of icky about it, or you're not comfortable about it, it doesn't feel right. Never do you should you ever feel pressured to prescribe something you're not. So fortunately, I haven't been in that situation, but I would just treat it like any kind of non-athletes, where I'm not gonna be prescribing anything where I don't think this is like appropriate. I don't think it's clinically indicated. Um, but sure, you might have a patient with functionally impairing ADHD, and the goal of stimulants in that case is not to kind of enhance their, I conceptualize this, you're not really enhancing your performance, you're just kind of normalizing your brain circuitry to back to like a normal level. That's all.
Mhm.
It's just sort of like, there's some dysregulation there, we're treating it, and that's all. We're just kind of getting to a normal level. So that's how I conceptualize it, and I stick to that.
Yeah, that makes sense. And kind of a similar question. Let's say you do decide to go the medication route. For example, let's take the hypothetical athlete with ADHD. How do you ensure that the athlete isn't becoming overly reliant on medication to perform, especially in those high stress environments?
So, yeah, overly reliant. So, really, with ADHD, it's kind of it's such a weird thing to be treating, because it's highly variable in how like a stimulant can be dosed. as far as kind of like short acting, long acting, Adderall. There's in the timing of it. There's so many kind of variations there. And so again, I will kind of I'll try to share my conceptualization of that as like what we're doing is, you have some brain circuits that there's not enough inhibitory um, circuits to kind of block out all the extra stimulus. That's what's leading to the distractibility, hyperactivity, impulsivity, that stuff. So what we're doing is we're just kind of normalizing it, and usually with that patients, it is a matter of kind of figuring out kind of what the normal is,
Right.
without being too keyed up on stimulants or anything like that. So there are red flags. Like if the dosing keeps changing or keep going up, that's not good. Um, or if there's kind of side effects like sleep and low appetite and stuff like that. So to answer, I mean, it's a tough thing to kind of balance sometimes, and that's athlete, that's everybody, because
Hmm.
sometimes it's difficult kind of finding out, well, what is normal, like
Yeah.
I still don't want to do this, but like you know sometimes you just don't want to do things and you have to do it anyway. So
Right.
it's a tough thing to balance, but usually you can kind of figure it out.
Yeah. Yeah, thank you for that. And looking ahead, what do you see as the future of sports psychiatry? Are there any trends or innovations that you're particularly excited about?
Well, one area that I am interested in is, so you mentioned I'm medical director of our TMS clinic at Rush. So TMS is we call like a neuromodulation intervention that treats depression and anxiety. Also, there's an OCD protocol, and it's not a medication. So I'm kind of really interested in um, and sort of bringing in TMS. I think as psychiatrists, sometimes we use it's too far down on the list of things we do. When I think it should be higher up in the treatment algorithm. But particularly for athletes, I think it should be really high up there because this is a really well tolerated intervention that you're not have to take any medication. It's just logistically there's you're usually doing it like every day, perhaps if you're doing like a formal
Mm,
course. The treatments themselves are pretty brief. So, I'm really interested in sort of fusing the TMS with more with treatment for athletes, more kind of a if not first line, then second line, instead of like fourth, fifth line treatment for
yeah.
depression or anxiety. Because it's a effective thing, and the big thing is just the tolerability is a lot better for it. So I'd like to be exploring kind of using it more sooner for athletes potentially when warranted.
Yeah,
And if
that's
I'm
really
correct,
interesting.
yeah, the TMS, it came out of the MRI, right? They found that people were feeling better after having an MRI done. Isn't it
I
it's magnets?
Yeah, so it is magnet
Yeah.
technology. It's targeting a specific area of the brain. So in depression, anxiety, it's the left dorsolateral prefrontal cortex. I'm actually not sure if it was people felt better after MRIs, but like I would be, yeah, I should know that, but it would be interesting
Yeah.
to look up how they found that. But yeah, we're targeting a specific area of the brain um, with magnetic pulses, and after repeated stimulations, um, you notice improvements in these areas of depression and anxiety.
Hmm.
And I think there are no side effects. Have you come across any side effects whatsoever?
So as far as side effects go, as far as serious but rare ones would be seizures. And
Mm.
seizures are like, exceedingly rare. We've never ever had a seizure, and nobody's gone on to develop a seizure disorder. Outside of that, the more common ones is pain. So it's a very uncomfortable thing to get used to. So the coil is mapped over to a specific area of the brain, and it feels like a woodpecker's tapping you. Our scalps are very sensitive, so it just takes a while to acclimate to that. Um, some people it doesn't bother them at all. Some people it's just really uncomfortable for like the first week. After that, they're doing fine. So that's the biggest side effect. It's just the discomfort initially. Other than that, maybe some headache. Some people I don't really see this a lot as far as kind of like documented side effects, but like some people describe just kind of feeling more drained after the first couple of treatments. And I think that's just from being like really tensed up, not knowing what to expect. But then after a few, everybody's kind of feeling fine after that. So pain, headache, those are kind of the more common ones. And if they happen at all, usually it's just early on in the course and then things are better. But there's no cognitive side effects, no other like systemic side effects. People come and go from work or whatever they're doing. So it's a really nice intervention in that way.
Yeah, that sounds super promising, especially, you mentioned there are those potential side effects, but the general tolerability as a trend for the people who are
Mhm.
using it. And are there any other innovations that seem to be on the horizon in this field that you might find interesting that could also have promise down the road?
Within kind of TMS neuromodulation or other kind of athlete specific.
Yeah, I was thinking within the world of sports psychiatry,
Yeah.
whether it's specific to for their TMS things or outside of that.
Well, it's kind of like, the directions that, the field right now is more headed toward is kind of figuring out better screening tools for this. You know, how do we triage people to the correct care? So a lot of like I was just at the Promise conference in Edinburgh, which is the International Olympic Committee's like mental health working group, and and they're always kind of trying to figure out um, how to you know screen athletes appropriately, and how not only that, of course, but then deliver appropriate care and interventions. So they were going over sort of what they had done for the Paris Olympics, and sort of the lessons learned there. It sounds like they were really happy with what they had instituted at that point. So a lot right now is just sort of like the thing is we know we we know how to treat people, uh, in pretty much any of these contexts. The barrier is screening appropriately, getting them to the appropriate level of care, etc. So that's kind of where most of the directions at this point.
Yeah, that
Is
makes
there
sense.
is there a particular message you'd want an athlete who's listening to you today to walk away with?
I guess it would be, um, yeah, I would prefer viewing y- you know, any kind of possible, like, if there is some depression, anxiety, performance anxiety, substance use issues, not to think about it of like this is something that should be addressed, that should be, doing it can actually enhance your performance and everything. Um, if if it's treated appropriately, just like you have to go to the gym, or you have to do whatever it is for your sport. Like you also have to be like make sure you're like mentally like where you need to be as well. So I would kind of put it in that context of like make sure that you're mentally doing well, so that you can do what you need to do.
We also like to ask our guests, what's your Everest? What's next for you?
Uh, well, professionally, just like I am building up my practice still, and then of course I work at Rush, where I still where I run the TMS clinic there. But outside of that, I'm trying to like take my own advice and trying to diversify what I'm doing. So, I'm learning guitar right now, and I'm trying to lean into the moments that I don't like, or where I feel like I'm backtracking. Sometimes I'm playing the same song over and over, and I feel like I'm worse than I was yesterday. But I'm trying to. So at the APA meeting this past May, Venus Williams was our keynote speaker, and she had said something that like resonated with me, where she said like she would lean into the suck. She would lean into those
Yeah.
moments that like really were not fun, because you almost have to kind of figure out how to like relish in it a little bit. And so I was like, so I whenever I'm like doing terribly, I'm like, all right, well, this is bad. I'm gonna lean into this. This is really bad. But you have to kind of like keep I don't know, just kind of wading through it, instead of just putting it down. I try to like kind of get through it a little bit. So that's kind of what I'm working on now.
I mean, I think that's fantastic, right? So I've certainly had athletes call me, write me, saying I just had the worst game, the worst round of my life, and I just say, well, congratulations, it's behind you. Now
Yeah.
Right.
it's all going to get better. Or for me, I know with my last marathon, and I'm running this Sunday,
Oh,
that
okay.
there's going to come a point where I'm not enjoying myself at all, and those are the moments where I really tell myself I chose to do this. There are far worse things out there, and I will be done with this terrible feeling pretty soon if I just keep moving my legs. So,
Right. Yeah. I love it. Yes. I so agree.
but but for sure, especially with the swimmers and the runners, they really have to just embrace the suck because it's not a game like most of
Mhm.
the other sports. It's just going to burn and suck till you're done.
Yeah.
Right.
Yeah.
But that's why they can do it and somebody else can't, right? So they're
Exactly. Yeah. I don't know if this is like very scientific, but my friends and I, whenever we're hiking, there's fun hikes. There's like what we call type one fun, where it's like it's
Hmm.
really
yeah,
beautiful, it's fun, and then there's like type two fun, where it's like kind of miserable during it, but you look back and you're like, oh, we did that. Okay. it's it's not in the moment, it's not great, but it's a type two fun. It's looking back, it's better. Yeah.
exactly. You survived.
Yeah.
Yeah.
Right. Well, Dr. Byrne,
Well,
thank you so much for sharing your time with us today. We're so grateful to hear all of your insights, and yeah, we are really grateful to have you on the show.
Yeah, thank you. I'm so happy to be here.
yeah, and look forward to collaborating on clients in the future.
Yes, yes, absolutely. And good luck on Sunday.
Thanks. I'll need it.